Welcome back to the show. We've talked about this topic on the show in the past, and that is our seniors and how they find themselves even more isolated than ever before because of the pandemic. And whether they're in long term care or whether they are at home, it is important to keep them socially engaged. And here to tell us more about the importance of that, I'm joined by Dr. Annie Robitaille. She's the research chair for Perley Health Center of Excellence in Frailty-Informed Care. Dr. Robitaille, welcome to the show. And let's talk about the Perley Health Center of Excellence in Frailty-Informed Care. Maybe you could just give our viewers an overview, an idea of what you do there.
Yeah, absolutely. So the Perley Health Center of Excellence in Frailty-Informed Care is, really leading a number of initiatives, programs, and research, evidence-based research, to really all aimed at improving the quality of life of older adults living with frailty and their caregivers as well as the quality of life of staff currently in long-term care homes. One of the key priorities as well that's been identified by the Center of Excellence is really around reducing social isolation and loneliness for older adults, and again, improving their quality of life.
Well, and I can imagine, Dr. Robitaille, just the mental health implications of that isolation, what that must be like. Maybe you can just speak on that for a moment.
Yeah, absolutely. So, I mean, we know that social isolation and loneliness has been a concern for older adults, especially those living with frailty. And so, with COVID-19, as you've mentioned, this has only worsened. Um, what we also know about loneliness and social isolation is that it is linked with a number of negative outcomes, including increased death, depression, dementia, blood pressure, reduced quality of life. And so it is, that much more important that we do everything that we can to reduce isolation and loneliness for older adults, especially during this pandemic.
So, Andy, let's talk about that. So, what is some advice you can give to people out there to help our seniors during this time?
Yeah, the obvious one is reach out to your loved ones. Make sure that you can connect with them as much as possible. And we realize that this is not always possible in person. And so, if it's not possible in person, there are still things that one can do virtually or outdoors that can help to reduce social isolation. So, if outdoors is a possibility, there is always, walks during the week. I always suggest schedule them regularly, and so they are part of your schedule. You can even bring your dog if that makes your loved one happy,
Yeah,
right?
yeah.
Um, and then if really if outdoors is not possible, I know that winter is puts people at increased risk of falls and stuff. So there's always these precautions that you need to take. But if outdoors is not possible as well, there is always virtual visits, and we have many success stories, both in long-term care and in the community, where older adults can easily use technology. Yeah, like
Let's
for
turn around.
yeah,
Yeah,
go
I was
ahead.
just going to say, let's talk a little bit about, staying mentally and physically active. I mean, that socialization certainly helps with that, getting outside. Unfortunately, some seniors with mobility issues, as you mentioned, can have a difficult time in the winter. But how can we help with that physical activity and that mental cognitive activity?
Yeah, you can help them by making sure that they continue engaging in some of the activities that they enjoy. So, for example, my grandma loves puzzles, knitting, and quilting. And we have been unable to see her in person. And so we've used technology to reach out to her. We've mailed yarn so that she can continue knitting socks for all members of the family. And I've actually taken up quilting so that I can quilt with her. And so I sew all the pieces together, mail it to her, and she does the applique. And we connect through technology and have a good laugh about all of the mistakes that I make. Um, and in addition to
Nice.
that, there's also full of videos, right, that are available for exercise
Right.
videos that are specifically for older adults that are meant to be safe and that are meant to, increase strength, balance, flexibility, and at the same time, you can do it with them virtually. Um, and stay connected that way as well, so that you continue, making sure that they engage in these activities
Yeah.
even during
So
the
important.
pandemic.
Dr. Robitaille, thanks so much for joining us today. Really appreciate it.
Thank you.
All right, take care. Hey, I should also mention, because Annie mentioned that, there are, videos available out there for exercise for seniors with mobility issues and so forth. We have a couple of those shows on Rogers TV, so I encourage you to check the schedule. We'll be back with more daytime right after this.